I mean, I guess you could stand next to him.
It's all loud.
I'll just do one of these numbers.
I'm not gonna mess your name up.
No, it's all good. It's cooler. Cooler.
Hello, everyone. We're going to start the presentation. I know a lot of you are online. Today we have Dr. Kula from the Neuromuscular Rehabilitation Center, and he is going to be doing our presentation today on musculoskeletal disorders. Thank you all.
Hey guys, as Stephanie said, my name's Dr. Jonathan Kula. I'm a physical therapist with the Center for Neuromuscular and Massage Rehab over at 17th and I. The purpose of today's lecture is to talk about ergonomic dysfunction, how you can interface with your workspace more effectively and reduce the amount of pain that you may be having. It's going to be a rather informal lecture and discussion, so I may require audience participation to help demonstrate a couple of key points. The first thing is, did anybody have any questions before we get started? Some things that are on their mind about problems that they've been having, or anything that's anything where you want me to tailor the lecture specifically towards specific conditions? Anybody? No? Okay. All right, well, let's just begin from the beginning. Ergonomics is basically how you interface with whatever you're doing. Whatever particular task you might be performing, whether it's sitting or typing at a computer, standing and fixing light bulbs, or even laying on your bed to go to sleep. It's all falls under the subsection of ergonomic stress. Particularly in the office environment, there are a couple of very typical stressors, shall we say. The most common of which is, of course, sitting. Now, sitting does certainly affect, forgive me, sitting does affect the type and extent of strain that you have in particular muscles. If you all don't have any questions before we get started, and just fire away if you do. We're going to start with the upper back, neck, and shoulders, because that's a common source of distress, things that we see in the clinic very, very often. Often called upper crossed syndrome. It is a series of dilemmas most concentrated around the trapezius muscle, splenius capitis, levator scapulae, and, although this one's hard to appreciate, the rhomboid muscle. Those are the muscles. If I can have a volunteer, now would be a great time. Anybody? Somebody? Come on up. It'd be a great time. I'll be gentle, I swear.
And did you say lacrosse? What did you say? Syndrome?
Upper crossed. Upper crossed.
Syndrome.
Yes, ma'am. Okay. So if I can have you turn, actually, forgive me, face right here is fine. Now, upper crossed, now what we have with this fine lady here is actually, let me have you turn to the side, actually. There's a slight curvature right up and through here. This is a very typical computer posture. Let me have you turn one just a little bit too. There you go. So up here we have prominent trapezius muscles. These have become accommodated to an office environment. There's also a slight curvature through here. Now, the trapezius muscles, they start way back up on the back of the neck and kind of blossom out, and then they come right back down here. You can appreciate that by this half of that slide. Now, if you were to look as far, go ahead and look as far down as you can for me. There you go. These muscles will now be on a little bit of tension. Okay, now if you look back up towards the ceiling, okay, now you're contracting those muscles. So stretching going forward and contracting going backwards, right. Now, these muscles become strained when sitting in an improper position quite easily. Thank you very much. I appreciate your help. I may call back up. I'll call you back up. Okay. Now, how do they become stressed and strained? Now, I've created a little bit of a setup here that's actually kind of mocked up to replicate what might be considered a pretty decent ergonomic setup without actually using a lot of fancy equipment. The first thing to negotiate, however, is your chair. When you're sitting in your chair, one of the ways you can actually strain the trapezius muscles is by not using armrests, sitting kind of close to the forward of your desk. And what happens is that people start their work day with all intents of sitting up with good posture. But gravity always wins. Always, always, always wins. So what ends up happening is you're sitting here, your arms are in front of your armrest, and you kind of collapse here. And that's what's called hanging out on your ligaments. Basically, the muscles of your back, the trapezius among others, have a certain amount of elasticity. And as you start to collapse down, those muscles stretch and hold to a certain extent. So they feel like they're supporting you. Now what happens is, as you hang out on those ligaments, that weight starts to cause a reflexive contraction of the muscles. It's not a voluntary contraction, it's a reflexive contraction. It means you're not really responsible for that contraction. It just kind of happens. Now, as the shoulders start to move forward, you start to round out, you can imagine this particular muscle starts to elongate. Over time, you get a progression where the shoulders start to round forward. The muscles on the front of the body, the pecs especially, start to tighten. Okay? So even when you try to get good posture, it's very difficult because of the tightness on the front of the shoulders. Now, one of the ways to help mitigate that, while sitting at your desk, put your bottom as far back into the chair as possible. Okay, so now you have one point of contact, right? Now, in terms of ergonomic efficiency, what you're going to find is that the greater the number of contacts your body has with the actual device, the less your body is going to have to work. So, first point of contact is your butt as far back as you can. Usually there's about 3 fingers width between the back of your knee and the front of the chair here. Now, that's subject to debate. Some people will want a little bit more. Some people really don't care how much. But most times, as you put your bottom back, if you start feeling the front of the chair, you're going to need to make some modifications. In this particular instance, it may be hard to appreciate, but this is actually a little close on me. Caveat emptor, I'm sorry. I didn't actually adjust this very well, so that could be a teaching point right there, I guess. Second point, and this is probably the most important part of a chair besides the support in the back, is armrests. Armrests, if you can't bring them into the width of your shoulders, your chair is effectively a stool, okay? So if you don't use your armrests, your shoulder muscles will never get a chance to relax, okay? Again, without armrests, I'm just going to kind of sit forward a little bit. The weight of your arms will slowly start to drag down, causing usually any one of a number of different problems, typically scalenes and upper trapezius problems right in through here. You combine that with the use of a mouse all day long. If you're not using your armrests, now you've taken the weight of your arm and brought it away from your body. That makes this muscle work a heck of a lot harder. That can even lead to things like migraines and chronic headaches and so forth. Suffice to say, your goal, putting your bottom as far back as you can, you want to adjust your armrests high and close. If you've ever watched a court stenographer typing on this tiny little machine very close in, that is the evolution of ergonomic perfection in the workspace, where everything is close in, your shoulders are back so that their weight goes through the axis of this joint. So it's no longer in front of you, it's underneath the joint. Now, interfacing with your desk. This actually, I've seen after years of working in the field, I hear all types of complaints from government workers very, very typically where, man, I just can't seem to get my workstation to work out for me. So I have them bring in a couple of pictures, the most common of which is your monitor is low and far away. So you're sitting there like, what the heck? Now, as you get into this position, I'm certainly hoping none of you all have that problem, but if you do, you can get into high cervical strain. I'm going to just take a slight sidebar here to discuss that. A high cervical strain occurs with these muscles way up there. Let me see if I can get a better slide for you. Right here probably would work. Now this is going to be hard to appreciate with a camera, so I'm sorry about that. As these muscles insert into the back of the neck, into what's called the nuchal line, they exert a very strong force to help control the pitch and angle of your neck. Now, those muscles are small and very weak and extremely prone to exhaustion. So whatever you do, if you are at your workstation and you find yourself in this position, back your chin up, okay? One of the ways that you can help give yourself some prompting is to bring your computer screen high and bring it towards you. Make the computer screen push you backwards so you can see very clearly, and you kind of want to get away from it. That will cause a reflex to let all of this kind of settle in place. Now, we left off, sorry for the sidebar, we left off kind of talking about where your hips were and where your arms are. Your elbows, want to have them tight and close. Now for you petite ladies, very difficult to find a chair that gets your arms to telescope. Yeah, to get your arms to telescope sufficiently inward. And for you big guys, it's hard to find some place that may come up high enough or can adjust to your side. So you always feel like you have to reach down with your body to find the armrests. If that's the case, you got the wrong chair. Okay, and if the chairs in your facility are insufficiently tall to make that accommodation, you may have to bring in, I don't know, some foam and some duct tape and build up your armrests so that you can have sufficient support. Now that is a crude way of managing it, but I've seen very few aftermarket solutions. If it's not in it with the chair, it's hard to actually make those accommodations. Now, back to your work setup. Having sometimes a smaller keyboard can help as long as you don't have the data pad. Okay, so that data pad can sometimes take a keyboard and make it really wide. Why is that troublesome? Well, number one, it eats up workspace, but number two, it gets your arms a little bit farther apart. It actually takes a little bit more work for your body to do this than it is to do this. So if you can see the angle of the armrests here, that is kind of the natural angle that your body is going to want to be at. Okay? Now, in this particular keyboard, very cleverly designed, small little mouse pad, right integrated there, can be very helpful. Why? Traditional mouses, can cause repetitive stress. And that usually occurs through the forearm, the wrist, the hand, people getting tennis elbow, also medial epicondylitis that's a separate set of stressors, don't worry so much about that. But typically pain up through here. One of the ways you can mitigate that is making sure that whatever mouse that you are using, you have a nice wide grasp and with your palm down. Okay? If you're clicking, oftentimes clicking is more efficient and less stressful on these muscles if you're doing something like this than you are doing something like that. If you can see the muscles of the forearm work, if you're doing this over and over and over and over and over and over again, there's a series of muscles called the extensors, and they insert way up through here. So if you just even do that, you can see all those muscles kind of dance. You're doing that all day long. Okay? Now, a common error in terms of the keyboard is how it's positioned. Back in the day, there was a lot of argument about carpal tunnel syndrome, which is still a prevalent problem in the workplace. A lot of keyboards used to have an integrated wrist support and so forth. That actually can cause some compression. You got to be careful with that. And if you've got the keyboard at the right height, you don't need it. Okay? And if you certainly have your arms and armrests, you don't need it. When it comes to the keyboard height, you want to be relatively neutral, or typing a little bit downhill is okay. Okay? Meaning having your wrists here. Having your wrists here is this is called extension, is no-go. It's not good. Yes?
What about a negative tilt?
A little bit's fine. I wouldn't.
Just a little bit?
Yeah, I wouldn't, because if you speak in terms of likelihoods, not just you, but the entire human race, as you start to tilt your arm downward, you start becoming mechanically inefficient. Okay? And you can all cause a little bit of compression through the carpal tunnel. So a little bit's okay. Your body will typically tell you what's too much. And if you're doing fine with it, great.
Yeah, I'm always in the middle because the doctors say they want the user at a 90-degree angle.
Mm-hmm.
And the ergonomists say they want them to type at a negative tilt. So I always tell people to kind of do both, or find what makes them comfortable.
Exactly right.
Would that be something okay?
Almost certainly. I wouldn't, a negative tilt or typing downhill, you've got a little bit of space in that carpal tunnel. Now, it's hard to appreciate how many ligaments, and I probably should bring it up so that you can see how many tendons, ligaments. You've got two large bones, 8 carpal bones, 3 major nerves, a major artery, major vein, all occupying the same space. When you take your wrists and do that, you start to choke it. Now that's 90 degrees. That's a heck of, nobody's typing like this, at least I hope not. So a little bit of tilt should be okay. Now if you do have some inflammation in that region, i.e. you've been typing a while, or you went out working in the garden or something like that, and your wrists are kind of hurting and you start typing downhill, what may, that inflammation and stress that you've had create swelling. Swelling can occupy space, and you can all of a sudden get symptoms where you didn't have them before. So if you are going to type downhill, just make it natural. Just try not to force it. Just a little bit is fine.
What about if the user complains about numbness or?
Okay, well there are a couple easy tests for numbness. Okay, have the user turn their palm up and tap right there, right there. That's a very simple test. A nice firm tap. Okay, and if it elicits numbness into the hand, that's a sign that they should probably contact a medical professional. They might be developing a couple of troubles. Another place that you can also tap is right on your funny bone. Now that's relevant to the lecture. Right in through here is called the cubital tunnel. The ulnar nerve comes through that. If a person's using their armrest for a really long period of time, you can get some numbness into these digits right through here. That's, if you've been resting it on the desk and clicking on your mouse all day long, you can develop quite a bit of inflammation there. If that's the case, you need to offload, meaning change the position of your armrests such that your arm hits part of the armrest but misses the cubital tunnel.
That's why the doctors say they want the foam arm instead of the polyurethane arm.
You bet. These things they're great in some ways, but you can see even with this particular chair, it's rounded. If it's rounded, that's a great way of just driving the support surface into that potentially affected area. What other questions you guys have?
So the foam arm is better?
Well, better is only in terms of what meets the person's needs or what they can tolerate without any increased stress. So if a person has, and this happens very often, if a person has a lot of mobility or if they're very slender and these choke points become inflamed, you may have to toss around a couple of different solutions before you come up with something that actually works well for the client. So it's not necessarily a matter of better or worse, but what's most effective. Somebody who does have cubital tunnel syndrome, for example, this would be too hard. Okay, they would need to make some sort of accommodation. What other questions do you have? Yes?
Go ahead. Okay, in this type of setup here, let's say the individual that you might be working with, they've got a setup that is relatively free of any recognized, potential hazards.
Okay.
Okay. And let's say that their mousing hand is their right hand.
Sure.
Okay. Oftentimes you have individuals who, for all practical purposes, everything looks fine with the workstation, but it's the opposite side that is actually bothering them.
I see.
And so what, in those type of situations, I get that a lot.
Are you talking forearms or shoulders or neck or?
A lot of times it's the right in here.
Sure.
That is bothering them. Neck
Left,
and shoulder area.
sure.
But everything, but they're predominantly right-handed or left-handed, whichever
You
the
bet.
case may be.
Ergonomics is almost always a usage-based issue. So then you have to go back and watch them at their workstation. Let me give you a couple of cues of why that instances, clues of when that would be a consideration. If, for example, the person is referring to a document on the left-hand side as they type. If a person is holding a cell phone in their left hand during your off-work hours, for hours and hours, and they're just kind of scrolling through it, anytime your body tends to, or if they hold the phone on the left-hand side as they want to type, those are under the categories of misuse and abuse to the muscles, okay, where the muscles are not made to, and that actually dovetails where I was kind of going to go next, but the muscles are made to be used in a very specific way. If you have something that is counterintuitive, they're mousing on the right-hand side, but they have left-hand side pain, you have to ask more questions, okay? Is that a usual find? It can be. And of course, there's also things like the strength of a dominant side versus a non-dominant side. And dominant side tend to be stronger. Now, that's a relatively weak argument in terms of ergonomics, but every difference in strength makes has a huge response in terms of ergonomic stress because you use them. The volume of use will be so exceeded by the amount of capacity that the muscles have to resist that stress. That's a long way of saying you have to look deeper, I guess. But sometimes it's quite common. And it may not actually even relate to the setup itself, less how they do their work. What other questions do you have before we go? Yes?
What about arthritis? I know there's not
Sure.
a lot you can do with it, but is there any special way they can use their computer or... I know
Sure.
some people have those things on, but I know the only thing you do with arthur is exercise.
Well, that's an excellent question and one that's difficult to answer because arthritis can strike so many different joints. I'm going to be, for the sake of argument, I'm going to be assuming that you're going to be talking most of the wrist and hand.
Yeah, wrist and hand.
Okay. That would fall typically under the category of rheumatoid arthritis, especially as people start to age, or if they have juvenile rheumatoid arthritis. The usage, what you're trying to do is be kind to your hands in those instances and offload as much as you can. Instruct the client to type gently. So literally just brush their fingers over the keyboard. You can tell with something like this, there's low profile keys. That's great because you don't actually have to lift and bang on the keyboard. Also, sometimes a split, if they have a lot of wrist pain, sometimes a split keyboard can help with that.
How about this?
That can be, yes, those vertical keyboards.
Yeah.
Those can be fun. There's a huge learning curve with those,
Yeah,
but
they have to get used to it, but
You bet.
it can help a little bit.
it
right?
certainly can because this is physiological risk neutral, okay? So something around this is a lot less mechanical stress, for sure, okay? Now, as far as exercise goes, man, it's hard to give advice without necessarily a person coming in, but most studies will say it's better to exercise and keep your hands and your forearms strong if you have a typing job and keep things as supple as you can than it is to not do that, because at least you can build some stress tolerances.
The most common question I get is,
Mm-hmm.
what position should I type in? I have rheumatoid arthritis or whatever. And, I was just wondering if
Sure.
there's any specific...
The answer to that question is, where do your hands feel most comfortable? Like if you have them at arm's length, a very, very stressed position, and then have them rotate their palms all the way up, all the way down, and usually they'll probably settle for somewhere right around here. So if that's the case, then a vertical keyboard is fine. Now, if somebody has, and what you want is to not just hold that in isolation. There are other factors to consider. Elbow pain, because that may change the dynamic of what you're trying to get out of the patient. Meaning if they have elbow pain, so you have to kind of look at not just what your target is, but the whole system, okay?
Yeah, and that would be like a temporary fix. We would have to send them to you first.
Ah.
After that...
I mean, not necessarily. I mean, what you're really looking at is to find a position of ease and comfort.
Right.
And that's ultimately the goal is if you find comfort, you'll be able to work as efficiently with the least amount of strain as possible. Any other questions before we move forward?
The pyramids up, the one that you can same type.
All right. Okay, in terms of, sure. But there's also another answer to that question that I forgot to mention. And I don't know how y'all's office works in this regard, but Dragon Naturally Speaking software, if you run into really bad repetitive stress injuries, accept no substitutes. I mean, that software is a very robust suite. You can really offload a considerable amount of your typing work. One of my clients used to be a journalist and had to quit because the repetitive stress got too much for the wrists and hands. So she ended up using Dragon almost exclusively to and relatively efficiently as well. Will it make you as fast a typist as before? No. You'll lose a little bit, but you can do your job pretty well, and your health is improved. So that is certainly a consideration, and that's a relatively low-cost investment for a really high-yield result. Sorry about that.
Training, right?
Yeah, you do have to train the software.
Dragon, you can get it in accounting software. You can get legal software.
You bet.
Medical, there's
Yep.
different software depending on your particular job that will use the language and everything else to associate the software with your job.
Yep. It's pretty incredible. Okay. Any other questions before we move on? All right, cool. Talking about support from the chair. So we talked about the elbows. We talked about where your bottom needs to be. Next is the common misconception about lumbar support. Okay, so what you're really trying to do with lumbar support is preserve the natural curvature of your spine. Okay, that's called the lumbar lordosis. Some folks, and if you're doing investigations with returns, what's that? Ah, lovely.
From the bottom.
Excellent, from the bottom. All right. No, that's cool. We have one of these at the clinic, so. Okay, so right here is your natural lumbar lordosis, okay? If you're looking at a spine, this is actually a pretty healthy spine, believe it or not, generally speaking. All right, now, there are a couple of architectural things you have to keep in mind. Some folks are what are called hyperlordotic, where you have this presentation where the bottom juts out quite a bit, okay? That creates mechanical stress. Yeah, it creates a lot of mechanical stress on what are called the facet joints. Also can cause some pinching along the backside of your intervertebral discs, okay? And it also foreshortens the lower back muscles, okay, making them work a little bit harder. And then there's what's actually worse, which is, I don't know if this is going to be able to show us, but a flattened spine, okay, or a hypolordosis. And that is your classic flat back, okay? Now, usually that's a little bit more trouble because as you sit down, that flat back is going to turn into this type of position where you've elongated the spine to the point where the muscles along the lower back, let me put this down for a second, called the paraspinals, become remarkably inefficient. Oops, there we go. So, the lumbar paraspinal muscles, I'll reintroduce you to my friend Frank Netter. He's the illustrator for these. These are your paraspinal muscles. Okay, I'm sorry, I know if I click on this, it's going to take me to some random web page, so I'm sorry about that. The paraspinal muscles start kind of up in the upper back. They go all the way down, and their job is to resist forward and control forward motion and to pull back, okay? When you're sitting, if you do not preserve that lordotic curve, the muscles shut off or become overstretched. So your goal is to avoid that, okay? Because much like what happens with your upper back, if you start hanging out on your muscles, on the elasticity of the muscles themselves, they actually having to start work harder. And also, like the upper back, they become inefficient when they're stretched out. Muscles perform well when they're in a relatively neutral position. Part of your job is to preserve that neutrality. A lumbar support needs to hit you right at the bottom, believe it or not, the bottom of your rib cage, okay? So if you guys take your thumbs and you hook them and you kind of come up through here, you'll be able to feel your floating ribs right there. That's where your lumbar support really needs to go.
Not above the belt?
Nope, because when you put it above the belt, remember, most of these things are fairly robust. They're, pillows and supports that are pretty big. And if you put it around the belt, what it may do is actually push the person into hyperlordosis.
Right above the buttocks. Starts to curve. So
Again,
right in the middle of
yeah, you have to bring it a little bit further up. Now, let me demonstrate. Come on up. Let me show you. Okay, so now, okay, and relax a second. So she has a slightly hyperlordotic spine to begin with, okay? So right about here is, because there is a nice reflex. What you're really trying to get into is the kind of an S-shaped reflex. If you give a very powerful signal, okay, go ahead and relax and just kind of hang out. Just kind of hang out, right? There you go. And then come on up just a little bit. Now, if I pushed you right there, that you see how her shoulders immediately came back, Okay? When you put support here, what you're trying to do is both govern the position of the lumbar spine and create a platform for success of the upper back as well. So have it a little bit higher up, and that reflex can help really bring those shoulders back. When it's too far down, you get into this kind of position where you want to, and the shoulders tend to, don't worry about it. Where basically this kind of thing happens. Now your body typically wants to either be in a C shape or an S shape. So if you have if the lumbar support is too low, it'll push your hips forward, and it's hard to bring your shoulders back when your bottom is in this position. But if you're here, it's a lot easier to clear those guys.
Ooh, I gotta put you in one of my chairs.
No problem, no problem. So again, and really nothing, it's a very easy thing to find. Find those ribs, come down just a little bit, and that's where that powerful cue will give you to get that extension, okay? Any other questions about that? And then remember, it also has to be that your butt has to go back.
Like
your bottom has to put your butt back in that chair. Now, exactly right. Now you've got another point of contact with the chair is your lumbar support, okay? Now, so your armrests, you've got a point of contact there, you've got a point of contact with the seat back, your lumbar support. Now, here's a question. Should you have your shoulders supported? No. No, you should not have your shoulders supported. If you type like this, you're lost because you eventually end up here. And this is ergonomically inefficient. Usually that lumbar support should probably be the last thing that your body has contact with. Now you have you're riding on a platform of your hips, your elbows, and your back, okay? If your body knows there's something back there, it's going to want to find it, okay? So try not to, and definitely don't type like this, okay? Please. So in terms of usage, if you are there's a sidebar with regards to the mouse. A couple of different options. Okay, well, there's your trackball. Keeping your hand in neutral is a good idea. If you notice that you're starting to get trouble into your extensors, using a trackpad is helpful. They also have stylus mouse where you use a pencil to be able to click and so forth. And those can be pretty efficient and very comfortable, and you can handwrite things and so forth. Okay. Yes, ma'am. Ma'am.
So going back to what you just said in terms of not necessarily having your shoulders supported, and I wouldn't tell anyone to sit like, it's like just, be natural. But in terms of high back chairs.
High back chairs are the worst. They're just the worst. You bet. Because when you introduce the possibility for any person to offload, they will. High back chairs should only be used is when your work is basically being completed or you need a postural break. You shouldn't actually be hanging out in the chair. If you can imagine, your goal is to get your shoulders back as you type, way back. If you have a high back, as you start to slouch, arms are going to start to move forward, and you've lost your ergonomic control.
Perfect posture is supposed to be with the shoulders back.
That's correct. That's correct. Now and your elbows back as well.
If you get that position seated, you're good.
Pretty much. You don't need to mess with it. Don't mess with it. That's gold. Sorry, but yeah.
No, because we do make the recommendation for a lot of times you'll have people that will say, I want my upper back more supported. And, so of course they're looking for that high back chair. At the same time, a lot of times when you have someone that may have, they're in a lot of neck pain.
Sure.
What are they looking for? They want a headrest, to assist them with that as well. So
if you find that when the person is seated in a high back chair, they get in a position like this, it's not going to help their neck pain. Okay? What is going to help their neck pain is maintaining its center of mass over the column of the vertebrae that is made to support it. The further forward that head gets, regardless of whether or not it's there's a little bit of a headrest against it, you're still going to have trouble. The goal of any ergonomics is to be able to have a person type for as long or perform whatever task as efficiently and healthfully as possible. Having something to rest on is perfectly fine, but that actually doesn't have much to do with ergonomics relative to the task. They can chill in that chair just fine, but when they come to type, they have to get away from that upper back, the backrest and the back support. That won't actually serve them, unfortunately. Sorry.
It's only there for you to relax.
Yeah, exactly. Now there's something to be said for that. Sometimes people do need to take a break, and having that available may be helpful, but is it worth the additional risk of having the person always rely upon that and believe that they're in a good ergonomic position because, hey, I've got a good ergonomic chair, right?
Well, I think the thing is making sure that we're educating our employees or our clients and customers as to the appropriate way to
Interface that.
Right,
You bet.
exactly, to use
You
it.
bet.
Because it's not. I mean, I guess the question would come is that are we to now say never ever recommend a high back chair again? And I don't think that
No, that's not
necessarily what we're trying to say, but that we want to make sure that you're using the chair
properly. Sure, we'll go with that. Let's go with that. Let's go with that. But if you are going to issue those chairs, you have to be an aggressive advocate for the patient or the client, employee. As you tell them just not to hang out there, because that's a position of rest. You're not supposed to do your job there. That's just not where you're. Also, permission to move forward. Okay. When you're dealing with off-angle stresses of the neck and shoulders, try to get all your work right in front. So with the very candid use of a couple of reams of paper and a 3-ring binder, you've got a place where you can put documents that you need to translate, and you've raised your monitor up to a point. Some people will say having you see all different versions of this. I'll tell you what the truth is. As the viewer looks, you want to maintain a straight up and down cervicothoracic angle. If you can get your shoulders and your chest where your ear, and you want to take a look at the client and make sure their ear is right over the shoulders is over the hips, elbows back. This is actually ergonomically sound. The question is, despite being ergonomically sound, does that mean you're not going to have any pain? No. You're just funneling the amount of error that's in your system away. So you can make a perfect ergonomic setup for somebody, and they may still have dysfunction. So back to the task at hand. We'll talk about that in just a little bit. Placing a couple of things right down here, perfectly fine. You've got a 3-ring binder. You can have things nice and close. Also keeping your desk space clean. If you walk in and you're doing an assessment and their desk is just a mess, you can assume that when they have to do something like handwrite a note, that can cause an enormous amount of stress. And if they do a lot of handwriting, that can be a huge culprit. Keeping it clean. Also, typing and translating. You don't want documents off to one side and and having to refer to them as you're typing. There's a reason why I'm not giving a presentation like this. It's because the muscles on the side of the neck are made to orient to something. They're not meant to stay there. Okay, so if you notice you're in this may be something to discuss with your clients that have pain as well. If you are in a meeting and you're referring to something in front of you and looking at a presenter, it's better to just take what you have, place it, and do this rather than to do this. Okay, that's huge. Also, if you have folks that routinely have to refer to their BlackBerries or whatever smartphones they've been issued, having their elbow supported by their rib cage, getting the device in front of you. It's lame, I get it. It looks ridiculous. Bring it so that you can use your own body as an ergonomic support. If you have to scroll, you bring the other hand in, and that's how you would probably want to do it. Keeping the chest forward, shoulders back, okay? And for God's sake, 20 minutes max, put the thing away. Put it away. Come on. I'm not addicted to my smartphone either. But seriously, chest forward, shoulders back. And this applies to whatever position you're in, okay? Now, if you have the benefit of an armrest, great, use it. But if you notice around the office, just walk in and see who's messing with their smartphone. I guarantee they'll probably be like, terrible, okay? Yes?
How much are you finding, and I know this may be off
Sure, off topic.
a little bit, but just in terms of the size of the phones, you know, we've gone from, you know, what was narrow to
I don't know.
bigger, but I mean, just
Yeah.
in terms of holding, you know,
Sure.
holding the phone and what, you know.
What metrics are involved with that? You bet. The answer is, what are you using it for? If you have a person who's required to have a smartphone for their work, you want them to be able to grasp it very easily and firmly and be able to manipulate, reach across the screen comfortably with one thumb. Okay? Now, this is about too big for me because I have actually remarkably small hands. So you want them to be able to hold and manipulate the device easily with one hand. So now then you start talking about use. If you have somebody who's got a very technical job that requires them to have a tablet or a smartphone, it may be way bigger than their body should actually be using. However, it's the nature of the beast. They also, if you're using the smartphone that's too big for your hand, get something like a very grippy casing for it. That can help. I don't know if that answers your question, though.
Somewhat. I just know, even for myself personally, which
Mhm.
is not a good thing, but that my hand gets tired. My fingers get
Sure.
tired from holding the phone.
I coached baseball, and one year, a couple of years ago, I had this young man come out on the field and say, "Mr. Ray, I can't play today." I'm like, "What do you mean?" His hands were so cramped from texting, because it used to be back in the day where you had to hit ABC, everything 3 times. His hands were cramping so bad because he was constantly texting. He couldn't even grab a baseball. 15 years old. Usually we see it as you get older and everything else. Here it is, starting with a younger age, using the devices that have become so much smaller instead of being larger. Like when we used to type, you have to pick your hands up to type. Now everything's so small, and they're getting into this much finer tuning. So a lot of times you are getting much more severe cramping. So anytime that you can have your hands open, greater than being cramped in, even when you're grabbing a mouse. You don't want to be cramping it like a 3-toed sloth and then working these fingers the whole time. So
He brings up.
it really depends on the size of the person's hand, and they really try to use different fingers as opposed to constantly your thumbs. So you pick up a finger, use your fingers, use your thumbs. Right.
Okay, I'm sorry. Second.
I prefer the interpreters to see eye level, so that's what I'm saying.
I see. Very good. No problem.
I don't get
Good.
type, so.
I'll figure it out, thank you.
No worries. Well, the truth is, if you start getting into that, you're getting into a repetitive stress injury. Usually when your hands start to hurt, it's a sign to stop.
Yeah.
Put the Candy Crush down.
And it's one of these things where I don't do texting as much as I'm scrolling. Just,
Well, examine that motion for a second. That's the same motion you have as a mouse click.
right, and of course I'm trying, just to not so much, but
No, it's okay. But the reason why that's relevant is because if you are accruing a certain amount of repetitive stress in your home life, that translates to work. If you're typing, that uses volume that your muscles are going to be able to, and you can kind of get some inflammation based on that. Okay, permission to move on? We're good? Okay, sorry. Excellent question, though. Okay, so monitors. If your monitor is low, grab a couple of reams of paper, push it up, easy peasy. If your keyboard is ungainly, and I've seen some trouble with this as well. Some folks have the trays that come out. Those can be easy to use and also really difficult to use as well. Oftentimes the largest complaint is that it butts up against your armrests. So now you have to pair the keyboard tray with your chair to make sure that they interface properly. Do the best you can with that, is all I can really say. You may have to play with its height and tilt to be able to interface and bring it close to you. Use of a headset, please, by all means, everybody needs to be using a headset when they talk on the phone. For God's sake, by the simple act of holding a phone, there's no good way to hold a phone for a long period of time. Consider holding it like this. Now all of a sudden you've got compression through the muscles on the side of the neck, and maybe if you have a little bit of underlying cervical nerve root pathology, get some numbness and tingling. You listen, say that, okay, fine, you bring your arm up. Now you can traction some of the nerves into the shoulder, especially if you're hanging out there for a long period of time. That can cause a lot of stress through the brachial plexus. So using a headset makes sense, it's natural, it feels fine. The evolution of phones of being larger, not smaller, generally has helped, except they're still really thin. So you're trying to do this. I mean, the amount of range of motion that you're required to even be able to do that task is kind of remarkable. So insofar as it's possible, if people have neck pain while at work, get them a headset, please. Please. Take the regular phone handle away from them. Give them a headset only. Okay. Is headache a frequent complaint with folks that come in? Okay. All right. Examine headaches, especially as they relate to the upper part of their head and coming in through here and referring into the side of the temples. Examine to what extent you have this as a predominant habit. Second thing, examine to the extent to which there is an increased curvature of their upper thoracic and lower cervical spine. You'll be able to feel it very, very easily. Okay, it's a prominence that kind of comes through here, right? Right up through here. That creates a bias for the neck to go forward. And if the neck is going forward, you don't type like this. You would naturally orient to your work. The solution is to get your shoulders back as far as you can, your chest is back. I know it sounds repetitive. That's the solution. My wife has it. It's a very common problem. We talk to her about it all the time. And then there's some things, of course, from an ergonomics perspective that you just naturally can't get around. Okay? And that is being at a desk for a long time. Get up every 45 minutes to an hour. Usually one of our classic secrets as therapists is to tell people to drink water all day long because you can't sit if you need to go to the bathroom, right? So not only does it help with pain mitigation, but it also is healthy for you to get up and move. And brings us to our next point, is changing position. A standing desk can be quite helpful. It's not at all required, and in some cases you have to be careful about standing desks, as they're not always a one-stop solution, I should say. So in this particular instance, the whole apparatus moves. That makes things relatively easy because what you're doing sitting, you're now able to do standing. And you want the same dynamics to be preserved in terms of where your arm. Okay, so this actually needs to come up a little bit higher. This is where you would want to be, okay? And doing all of your tasks in a small little space, all right? It's very, very simple, very easy. Hang out there 20 minutes, half an hour, as long as you're comfortable. The secret to ergonomics is move before discomfort sets in. We all get locked in. DC is a very stress-heavy environment. Move before you're uncomfortable. If you don't, inflammation has a cascading effect where it's harder for you to recover the longer you've become inflamed. Another hard thing to manage is the side-by-side monitors. It is better to have monitors above and below, if you have to have two, than to be side-by-side. For the very reason why these muscles are made to orient only in front of us. Okay, getting back to, let me go ahead and bring up
But
the,
then when you work your neck, if it's above and below?
it's not just a matter of are you working your neck, but what neck muscles are doing the work. If you examine the, let me see if this pulls up correctly. If you examine the strength and size of the muscles performing the work, I don't know where my previous slide is, but the trapezius muscles, when acting both sides at the same time, are a lot stronger than the small little strap muscles through here, some of which are beneath here. All right. And they insert way high up. They're very tiny muscles. So those don't work well for long periods of time. It's better to use the large dynamic muscles and do this than it is to do this all day. If you have to have the side-by-side, you declare a primary monitor. Big, large, lots of work, big monitor, and a secondary monitor. The secondary monitor should be very, very close, in fact, intimate with it. And then you allocate only the least priority stuff the furthest away. So you're staying mostly in front of you, and if you have to refer to something to the side, you refer to it occasionally, not all the time. Yes?
So those document holders that go on the side.
They can be a little rough, yeah, especially.
And it's better to motion this way than to work just the eyes?
If you can, if you have such visual acuity to be able to only use your eyes, that's great. Normally, people have a reference point of about, 10 inches around in terms of what they can move their eyes. And that's about kind of like 15 inches in front of you. When you start expanding that, you naturally start to move your head. So you want to keep that work as little as possible. And if you have to do that type of work, if you have to orient, it's easier to do this than it is to do this. Now, I'm not saying that, I'm saying that. Okay, use the whole neck to be able to perform the motion. It's tough, but if you have more workstations to deal with, that's the only way to do it. All right? And it's the same metric. You would want a primary and a secondary monitor. The primary one would be the one that you refer to the most, and then the secondary one, you would keep work relatively to the lower part of the screen, blah, 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 blah. What other questions do you have about that? Okay, so I was going to have you guys bring up a person to demonstrate strain to the muscles by having a person literally lift maybe or keep their arm out extended for a long period of time and just see how long they can hold it. It turns out you'll be able to hold it for about 3 or 4 minutes, but we're expected to hold your arm all day in a mouse position. No, get your arm rests in the proper position. Keep them nice and tight. You'll find that if you start chasing the mouse all day, you're going to have trapezius strain. That's just an unavoidable consequence. You bet. You bet. So everything in close, tight, high. Let's see.
And you should motion the mouse just going here, right?
Yeah, and when you have something like this what's integrated, it's very, you have no choice. It almost makes that choice for you. People have different opinions about having something integral with the keyboard. I tend to prefer it because, you're with this, it's a pretty good solution, really, because you're just doing a motion that doesn't have the same repetitive stress of tap, 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 tapping. Trackball is probably your second choice, your regular mouse being the third. And these are pretty accessible and relatively inexpensive. What other questions do you guys have? Okay. Yes?
I had an employee that was complaining about something similar to motion sickness, and she only experienced it after working at the computer for about 20 minutes, and only happened at work, it never happened at home.
Did the client have any visual, do they need glasses or have poor eyesight?
No.
Okay. The first place they might want to consider is going to an ophthalmologist to be able to understand if there's a problem with focusing, vision, and there's what's called a vestibulo-ocular reflex. That basically says that the eyes and the inner ears, there might be a disconnect. If they're using their eyes to track back and forth over and over and over again, and the eyes aren't focusing properly, that can sometimes trigger that reflex. Not what I would consider a common problem. If that were the case, I would probably have the person push the monitor actually a little bit further back for that particular solution, so that their eyes don't have to track quite as much. Does that make any sense?
Yeah, and she uses a lot of spreadsheets as well, so, and I was asking her to adjust the font, the size if she could.
You bet. You bet. Make it a little bit easier to see, perhaps? Yeah. That should be okay.
Wow, I've never heard of that.
What other questions? Okay. What I want to end with is whatever works and keeps a person safe is what you want to go for. I've expressed my professional opinions. That's one slice of the pie. You guys see things that all day long and negotiate and manage people who have individual needs. I can't necessarily account for every situation that comes across. However, it is quite true that there are a couple of very simple human truths. The body doesn't do well like this. It just doesn't. It's mechanically inefficient. So get everything back. The head doesn't do well when it's forward like that. Bring it back. Any time we're chained to our desks, even if we're doing the best we can, get up if you can. Anybody that has to do the same job over and over again, there's bound to be some sort of unavoidable stress, even in the most perfect situations. Your jobs, I guess, are to find the metrics as you're trying to outfit your client. Find the metrics, their shoulder length, how they're carrying themselves, what is modifiable or supportable or that you can accustom the client to. For example, sometimes a person will have a persistent kyphosis, where their upper back is curved and they can't undo it. If that's the case, the only thing you can do is support. You can't necessarily put them in a perfect circumstance. If you had questions, you can just shoot me an email anytime, asking something in particular that might be helpful. But for repetitive stress, you do have to be careful. Sometimes, do you guys issue like compression gear or braces or anything like that? Okay, gotcha. So just what we see around us here.
Ergonomics.
Gotcha.
Well, I try to address it more preventive maintenance. And try to, like you say, keep them back in the chair and bring the work to them instead of bringing themselves to the work.
Exactly right. Well, that's pretty much it. Unless you guys, yes, ma'am. Oh, sure. Our center, the Center for Neuromuscular and Massage Rehab, or CNMR, we're a physical therapy clinic and chiropractic clinic right over at Farragut West. We have 7 therapists there, a mixture of physical therapists and chiropractors. And ergonomic stress is something that it's probably about 40 to 50% of our caseload. And the amount of chronic pain that comes about from that, the amount of lost work hours, lost productivity, job dissatisfaction, stress that comes from this, like you're like the first line people. They see you before they would see me. You guys need to be able to, really listen. It sounds like you've got a pretty good grasp, though.
I think so. I'm thinking of my question. Excuse me. How do you connect what a patient may come to you with in regards to other factors that are not related necessarily to the work, but
Absolutely.
that may be ergonomic
You bet.
overall?
During their initial intake, when a patient sees us, they don't necessarily complain about their work. They complain about what's giving them trouble. Like, oh man, this neck pain is really trouble. I've got a little bit of numbness down my arms and tingling into my hand. What's going on with that? So we usually go through a battery of stressors in terms of their things like functional limitations. Do you have difficulty lifting things, moving things? Did you strain it while doing sports? Tell me how you sleep. Tell me the movement patterns that you have when you're putting away your dishes. And then some people may come up with, I have a client right now who is a percussionist and plays a lot of instruments and has repetitive stress there. Very frequent, but still has to work. So how do you negotiate those stresses and separate those from the work? Well, you can't. It's just the volume of work that a person has to do. Ultimately, we just basically look at their functions that they do on a very frequent basis, and dangers, like how are they doing these particular functions? Like, take pictures of your workspace, bring them in. Oh my God, you don't use your armrests. You don't even use your seat back. Okay, your monitor's down low, you've got 2 of them, and you're looking at something as you translate, like the complete worst setup you can have, and then you start to say, okay, let's rein all this in. And for folks that do have repetitive stress, the job is the most important place to fix things. Like, we can do so much in the clinic to help, but we're 1 hour 2 to 3 times a week compared to 8 hours a day, 5 days a week, maybe even more at home, plus, casual smartphone use. So there's a lot that goes into it. You do have to pare down a lot of details.
Yeah, I think that's some of the different psychosocial factors that might be involved as well. So whether you may be looking at things from, what are your peers doing or your coworkers doing, as opposed to, age. You still have age, gender, all those things that come into factor that we have to factor in as well.
Sure. I can only imagine what the office environment that you guys see on a daily basis. It's very different from the office environment that I have on a daily basis. However, yeah, if there's pressure in terms of how you negotiate your work, how many hours you need to sit at your desk, you all are working on a project that needs to be pushed out by Friday, and everybody's hammering in, there's a responsible use pattern that people need to fall into with regards to their own body. Something like a standing desk can really help with that, because you don't really lose as much productivity, but you can really change the metrics and how you interface with your work. What other questions do you guys have?
I do have a question about working out. I'm wondering if lifting weights, doing these motions can reduce the pain in this area. Where you're developing these muscles to strengthen them?
Mm-hmm. The answer is yes, but if you already have inflamed muscles, if you have a lot of pain, working out can make that worse at first. So the first job is to make sure your muscles are healthy and not overused with the amount of work that you have to do at your workstation. If you're doing okay with that, then training those muscles can sometimes help reduce that stress, as long as it doesn't increase your symptoms. What other questions do you guys have?
All right, thank you.
Okay. We cool? Yeah. All right. Well, thank you for having me.
Thank you.
Any other questions I got? Fine. All right. Cool. Appreciate it. Floor is yours.